Hey guys, sorry I haven't been good in terms of posting content for the last few weeks. I was just trying to knuckle down and focus on my pediatric rotation that started a few weeks ago, and pediatrics is solid. Me and my friends literally coined it medicine within medicine, because a lot of stuff that you learn in pediatrics you find doesn't apply to adults. And there's so many conditions that are unique to children that you don't really see in adults, and it's just, when I first started out, it was so overwhelming because I was seeing all these new conditions every day in wards which I've never heard about before, so it was kind of like learning a new language. So yeah, I literally just felt like I had to focus over these past few weeks, and now I'm comfortable enough to actually allocate some of my time to actually making YouTube videos. So that's literally what it is. If you do want sort of like a daily vlog on what a day in pediatric rotation is like, then let me know in the comments below, and I'll try to get over the fact or the fear of trying to record myself in public. But anyway, just let me know and I'll make sure I deliver. So this video was essentially a part 2 of the previous video, which talked about the NHS hot topics. I initially intended to talk about 3 hot topics in the video, but I didn't want it to drag on for too long, because my audience rate is absolutely atrocious at the moment. I think the last video had like people were only watching it for like 40 seconds, and when I found out, kind of did break my heart a little, but we move. So yeah, it's all about improvement. So that's why I'm planning on keeping my videos around 10 minutes. So yeah, I'd literally had to cut that video short. So this video in a way is a continuation of the previous video, and it's going to talk about the Dr. Bawa-Garba case. Now, this case started in 2011, February 2011 to be exact. And why am I making a video about it now? That's because, for those who don't know, this case was only recently concluded in 2018, or in August of 2018, so it's been a bit more than 2 years. So it's still quite fresh to be asked in your medical interviews, and it's still very relevant because it's literally made waves across the NHS. Just to go back to the timeline, or just to give a little background information, this case is basically regarding Dr. Hadiza Bawa-Garba, who is a pediatric doctor. Wait, this was not planned. I'm literally in a pediatric rotation myself. Talk about coincidence. But anyway, Dr. Hadiza Bawa-Garba was a senior pediatric doctor who was 6 years into her specialist training in pediatrics. And she basically, what happened is, in 2011, she was responsible to care for a 6-year-old boy called Jack Adcock, who had Down syndrome and associated heart condition that he was basically taking heart medication for. So in 2011, he presented to A&E with symptoms of nausea, diarrhea, and difficulty in breathing. And due to systemic failures within the hospital, his chest X-ray results came 6 hours later after it's been done, and it was found out 6 hours later that the causative organism for his chest infection was bacterial in nature. So rightly so, Jack was started off with a course of antibiotics to sort of clear the symptoms and make his condition better. So what happened is, Dr. Hadiza Bawa-Garba, it's actually a tongue twister, but I'm just going to say Dr. Garba. So Dr. Garba basically allocated the job or the responsibility of administering these antibiotics to Jack to a nurse called Isabel Amaro. But what happened is, there was a 1-hour delay in sort of administering these antibiotics, and by that point his condition has worsened. And this was probably the most important aspect or fact, was that Jack's medication, the heart medication that he usually takes, it's actually contraindicated for the course of antibiotics that Jack was placed on. And although this was found out, it wasn't put down on the notes. So the nurse who was administering these antibiotics did not exactly know about the heart medication that Jack's currently taking. So what should have happened was that these heart medications should have been discontinued throughout the course of these antibiotics and start again after the course has been fully completed. But this was not done. They were both taken in conjunction. So what happened is, an hour after that, Jack's condition drastically worsened and he had to have CPR. And what made things a lot worse was that Dr. Garba confused Jack with another patient, also called Jack, that actually signed a DNAR form, which is a do not attempt resuscitation form, which basically states that if your heart stops beating, then I wish, well, in a patient's perspective, I wish not to be brought back to life, essentially. So because of this slight confusion, or quite a major confusion, there was a 1 minute delay in trying to resuscitate Jack. Now let me just explain the severity or the degree of the situation. When your heart stops beating, every second counts. And the longer your heart stops for, the greater the risk of, or the greater the degree of damage due to ischemia. So unfortunately, at 9:20, Jack had passed away because his heart would not restart with a CPR. So quite naturally, following Jack's death, a full-fledged investigation was put into motion. So 4 years later, in November 2015, so the nurse in charge of administering Jack those antibiotics, Isabel Amaro, was given a 2-year suspended jail sentence for her negligence. And Dr. Bawa-Garba was also convicted of gross negligence and was given a 24-month suspended sentence, which means that she was not allowed to practice as a doctor in the UK for the next 2 years. And in June 2017, the Medical Practitioners Tribunal Service, or MPTS for short, which basically is a body that determines whether a doctor can continue to work or not as a doctor in the UK, deemed that Dr. Bawa-Garba should be suspended for 12 months from work and get back to work again after. So effectively, Dr. Garba wasn't allowed to practice for 3 years. So the 24-month sentence that was given initially, on top of the 12-month sentence that was given in 2017 by the MPTS. However, so this is where the conflict originated from. Dissatisfied with the MPTS's decision, the GMC appealed to the High Court. The chief executive of the GMC claimed that the MPTS was wrong to allow Dr. Garba to practice and ultimately wanted her to be struck off the GMC medical register permanently, which means that she will never be allowed to practice as a doctor in the UK again. However, in January 2018, the court overruled the tribunal or the MPTS's decision, and Dr. Garba was in fact erased off the GMC register. And then from January 2018 to August 2018, so the decision of the court's appeal provoked a massive uproar and protest from doctors, and a crowdfunding campaign was started that raised £350,000. So this money funded an independent appeal. And finally, in August 2018, Dr. Bawa-Garba was placed back on the register. So that was just literally a snapshot of what exactly happened over these 7 years. So there are two main parties in this discussion or this debate. One was the MPTS, who was sort of siding with Dr. Bawa-Garba, because after the investigations, it was found that it was not entirely Dr. Bawa-Garba's fault, which I'll get to in this video. But the other party, GMC, was trying to say, listen, she's into a 6-year specialty training. She should have been trained for this. She made a mistake that effectively costed the life of a 6-year-old boy who had so much to give to the society if he was still alive. So let's talk about the GMC's perspective. So the perspective of the party who wanted Dr. Bawa-Garba's name to be permanently erased from the register. So I'm going to read off the facts here. The first thing is, Dr. Bawa-Garba herself admitted to making a series of mistakes in relation to Jack's care and said that she underestimated the severity of this illness. What initially caused the backlash is that doctors in the UK are trained to practice the concept of veracity, which basically means speaking the truth, being completely honest regarding your practice, and just trying to come up with solutions in order to fix and improve for the next time such similar occurrences occur. So Dr. Garba, rightly so, she put her hands up and said, you know what, it is my fault, I should have been better. But the GMC took this as a form of incompetency or inadequacy on Dr. Bawa-Garba's fault. So this was the first initial concept. The junior doctor or the doctor's appeal was that how can you expect doctors to be fully honest regarding their practices if they aren't protected by the GMC themselves? So that was the first major sort of debate that caused an uproar. Anyway, Dr. Bawa-Garba owned up to her mistake, and she herself stated that she should have checked the OBS chart and should have spotted abnormal blood test results earlier. She did not ask the consultant to review Jack during the handover, and she did not specifically inform Jack's mother about stopping Jack's heart medication. So even though she knew about it, she didn't really tell the person who was administering Jack his heart medication, which is his mum, to stop it until the course of antibiotics have run their course or have been completed. And last but not least, she confused Jack with another patient, which led to a 1 hour delay in the CPR or the resuscitation. And like I said, every second counts in this, and 1 minute is quite a significant amount of time. So basically the GMC stated their personal culpability or the lack of competency ultimately caused the death of their 6-year-old boy. And they also stated that she would be harmed to the public if she was allowed to carry on. Which, when I was reading this case, I thought, because I knew both sides of the argument, which I thought was just completely disproportionate. And I'll get to why when I talk about the MPTS's perspective about this case, which is the party that wanted Dr. Bawa to continue practicing as a doctor. So essentially, yeah, Dr. Bawa-Garba was struck off the GMC. Now, the MPTS's perspective was that Dr. Bawa-Garba did make some mistakes. And I'm sure all of you heard that caring for a patient is a multidisciplinary approach, right? So when something goes wrong, especially to the extent of the death of a patient, the blame cannot be put on a single person. It's usually always a multifactorial dysfunction. It was found out through the investigation that Dr. Bawa-Garba was doing the work of 2 registrars at the time. She came out of maternity leave, or she returned from maternity leave, only to be working for 12 hours continuously before these events unfolded. So it was a very high intensity setting. She was working for 2 registrars effectively. She was working for 12 hours without a break when these mistakes have happened. There was no formal induction in this new hospital that Dr. Bawa-Garba joined after her maternity leave, and the consultant on call was off site until 4:30 because he had not realized that he was on call that day. So this is what I mean by a multifactorial dysfunctioning of the system that led to the death of this patient. So basically, the independent campaign or the independent fundraising campaign was set because this particular case resonated with so many junior doctors, because they feel that they need to work for prolonged hours but also be expected to maintain optimal patient care. And when they are being honest about their mistakes, they're not being well protected by the GMC, which is, the governing body that basically is meant to care for you. So they basically claim that it is unsustainable to maintain high quality of care while also working for long periods of hours for a long time, because essentially there is a balance. The MPTS also stated that before this case there were no concerns regarding Dr. Bawa-Garba's ability to work as a doctor safely, and it was also found out that Dr. Bawa-Garba was in the top 3rd decile of a specialist trainee cohort. So she was definitely a capable doctor. She was performing in the top 3rd of her decile, and she made no mistake whatsoever in her 8 years as a fully fledged working doctor. So which is why I felt that making Dr. Bawa-Garba, or the GMC's perspective in that making Dr. Garba work again as a doctor is a harm to the public, was a bit too extreme. So there was no questions that mistakes have been made regarding the care of this patient. However, it is important to realize and understand that the mistakes sort of came from different directions and it was not from one person, which is why Dr. Garba was essentially put back on the GMC medical register. So when you're talking about any case like this, any case that is, controversial, it is always important to see both sides of the story. So the both sides here was the GMC's perspective, which didn't want Dr. Garba to practice as a doctor, and the MPTS's perspective, which was, you know what, it's not all her fault, give her one more chance, basically. So it's when you're talking about an ethical scenario such as this that has two sides of the story, it's important to elaborate on both sides and then give your opinion and explain what side of the fence that you sit on. So yeah, that's pretty much the Dr. Bawa-Garba case. I'm going to stop this video here because it's probably going to be, I don't know, haven't edited this yet, but it's probably going to be 10 minutes. And also let me know if you did find this helpful. Let me know in the comments below, or just give me a like on this video. That really keeps me going. And yeah, I think the next video I'll be talking about the privatization of the NHS. And again, because it's a controversial topic, I'll be talking about both the pros and cons of privatizing the NHS. So that's it, guys. Thank you for watching this video, and yeah, good luck with your interview prep. And don't worry, there's lockdown now, so you've got a lot of time a lot of time left. So yeah, I guess that's a little bit of a silver lining. So yeah, good luck, and I'll see you guys next week.